known, is another pandemic which is growing slowly. And let us see why it is so important to understand about this problem. So let me start with this case who was referred to me by Dr. Piyush himself. So he is a 58-year-old gentleman, Asian man, came to me in October 2023, had history of diabetes and high cholesterol since 2002, long history as you see. And he had early compensated cirrhosis liver with portal hypertension. His weight was 104 kg and his BMI was 34, blood pressure was fine. He was on multiple oral medications for diabetes and high cholesterol, overall suboptimal lifestyle, and he was referred for weight loss and managing diabetes associated condition, because that was the one thing which our gastroenterologist thought, that if he loses significant amount of weight, it can actually prevent the progression of his liver disease and can give him some benefit of that. So if you see, liver is the largest solid organ of the body. It has hundreds of functions. It detoxifies also the body. And it's a key organ in glucose, fat and protein metabolism. Now, how do we define fatty liver disease in diabetes? The fatty liver disease was earlier known as non-alcoholic fatty liver disease, but the name has been changed and now it is known as metabolic dysfunction associated steatotic liver disease. And we diagnose it when the liver has more than 5% of fat, and if a person is having one of these four metabolic problems, whether it's pre-diabetes or diabetes, overweight or obese, having dyslipidemia or high cholesterol on treatment, or having hypertension and is on treatment. So this is the whole spectrum of fatty liver disease or steatotic liver disease, where metabolic dysfunction associated fatty liver disease, which is commonly known as fatty liver disease, is one of the commonest causes. There are other causes like alcohol and other uncommon causes, but the commonest one is this. Now if you see the fatty liver disease in diabetes, it is the most common liver disease worldwide. And it affects nearly 60 to 70% of people with diabetes, which is a very big number. It may trigger the development of type 2 diabetes, because liver is at the helm of glucose metabolism and fat and protein metabolism. It's the commonest cause of liver cirrhosis and liver cancer in people with diabetes. It is not only restricted to liver, it's negative or bad health effects, they go beyond liver, and these people are at higher risk of cardiovascular disease, mortality and other malignancies. The good news is, it is reversible in early stages and it is preventable. If you are diabetic, it is preventable in your children and your other family members if they have not developed yet. Now, the risk is much beyond liver, as I told you, that these patients are at high risk of heart disease, development of diabetes, osteoarthritis, PCOS, liver, GI malignancies and gallstone formation. So when you are seeing fatty liver disease, just don't think or concentrate only on liver. The bad effects are far-reaching. So how does it develop? The diet, which is rich in high caloric food and high fructose corn syrup items and high fat, that goes to fatty tissue or adipose tissue of the body. Now these people who are consuming this diet, and if they are overweight and sedentary and family history of diabetes, they develop insulin resistance, which is the resistance to action of insulin at the fat and at the level of liver and muscles. So insulin has a function in the body, not only controls the glucose levels, it also controls the fat metabolism. When there is insulin resistance, there is increased release of free fatty acids from the fat tissues. And there is a resistance at the level of liver also. This extra fat tissue and extra calories or glucose which is coming from caloric dense food, it goes to liver. The extra glucose which you consume or extra carbs which you consume, that also get converted in the liver in fat, and this triggers the development of fatty liver. Now in early stage, this fatty liver is reversible, but if the person continues to maintain the unhealthy lifestyle and there is a continuous inflow of fat in liver, this fat actually starts damaging the liver cells and starts hepatitis, which is known as MASH or NASH, and then eventually it leads to fibrosis and cirrhosis. Now this is the spectrum. You can see here that the fatty liver disease, healthy liver has less than 5% of fat. More than 5% fat means person has developed MASLD, and then if it's not being acted upon or reversed, then it goes to steatohepatitis. You can see here MASH, then from MASH some will develop fibrosis and cirrhosis. Out of that some will develop hepatocellular carcinoma. So it is not that benign or not just looking condition, we really have to act on it. Now how do we diagnose it? There are different lab tests: FIB-4 score, ultrasound abdomen, fibroscan and MRI. The simplest are the lab tests, the liver function test, and mostly ALT and AST, they are more specific, but we do full to see that there is no other problem. We do the complete blood count to check platelet count because that helps in calculating FIB-4 score. Serum biomarkers, which are enhanced liver fibrosis test, not easily available. It's a complex test, not easily available. And then other liver tests which gastroenterologists, hepatologists, they do to rule out the other cause of fatty liver disease. Now ultrasound abdomen, as you know, many of you go for ultrasound abdomen. So there we check how much fat is in the liver, what is the grade. So grade 0 is liver is normal, grade 1 is mild, where 5 to 33% of fat, then grade 2 is 34 to 66%, and grade 3 is more than 66% of fat. So grade 2 and grade 3 are not good, and we should seek the expert's opinion. The next test is FIB-4 score, which is an online calculator which is available. There we use the age of the person, liver function test like ALT and AST, then platelet count, and you put these figures and you will find the FIB-4 score. If the score is less than 1.3, very low risk. You can repeat this score in 2 to 3 years. The score is 1.3 to 2.67. We should do the next test, which is lipid fibroscan, RELF. More than 2.67, again high risk, we should do the further testing. Usually we prefer to refer the patient if the FIB score is more than 1.3 to hepatologist or gastroenterologist. Next is fibroscan. It's an outdoor procedure. It takes less than 10 minutes. It measures the liver stiffness in kilopascals. So the normal range is 2 to 7. And more the score, more the liver is damaged, or is having steatohepatitis or fibrosis. Now, in some patients who are very obese or having ascites, we cannot do this test because of the limitations. Now, if it can be combined with serum biomarkers, we can have better results. Now, the next is MRI. Now, this is not the regular MRI, this is a very specialized kind of MRI. We call it as MRI PDFF, or proton density fraction, which is good to detect and monitor steatosis or fat. Then second is MR elastography, which is the best tool to detect and monitor fibrosis. Not all the diagnostic centers have this. Only the centers of excellence for hepatology or gastroenterology or very advanced centers, they have these tests, but they are very effective. Now next comes to treatment. The most effective treatment is weight reduction. And lifestyle is most important. A healthy balanced diet which is not caloric and fat dense, more rich in fiber, not consuming too much of fructose corn syrup loaded items. And if we can lose 5 to 10% of weight, there can be good resolution of a reversal. But if it's advanced in like MASH and all, then person needs to lose more than 10% of weight. Now how do we treat it? We have different medications. Out of anti-diabetic medications, we have pioglitazone, are GLP-1 receptor agonists, which are liraglutide or semaglutide, then injectable or oral form, then GLP and GIP agonists together, this dual incretin we call, which is tirzepatide. Some beneficial effect of SGLT2 inhibitors has been observed, like dapagliflozin, empagliflozin, canagliflozin, which some of you must be taking. Then vitamin E and ursodeoxycholic acid also we prescribe when we don't have much options. Now this is a new drug which has been approved in March by FDA, resmetirom. And this has been approved for MASH. And this has shown good results. And then don't forget that the contributory factor in fatty liver disease is the high cholesterol or hyperlipidemia also. So we need to treat high cholesterol also, not only sugar and weight. Now in other cases where nothing is working, we have tried everything and obesity is there, and those patients with the BMI of more than 35 and diabetes, some of them we advise them to undergo bariatric surgery if they are not responding to the usual medications. And you know that there are different types of surgeries which I won't go in detail. When should we refer to gastroenterologist or hepatologist, or when should you consult? When FIB score is more than 1.3, ultrasound fatty liver disease grade 2 or more, abnormal liver function tests which are persistently more than 2 to 3 times higher than the normal. So early referral can make a lot of difference. So with that, I would like to summarize that MASLD or metabolic dysfunction associated steatotic liver disease is the commonest liver disease worldwide. It affects nearly up to 70% of diabetic individuals. Fortunately, it is preventable, and early diagnosis and treatment actually can reverse and prevent the further progression of it, and weight loss is the most effective treatment. Now we have newer medications which are not yet available here. Hopefully when they are available, then we'll have more tools to manage it. So thank you very much, and this is my wonderful team at Prime Data, which most of you are aware of. And once again, thanks for patient listening. And I'll be glad to answer if you have any questions, or if you want to say something, it will be my pleasure. Dr. Piyush.